Premature birth. Definition: a premature birth is a birth that takes place more than 3 weeks before the baby is due. In other words, a premature birth is one that occurs before the start of the 37th week of pregnancy. Normally, a pregnancy usually lasts about 40 weeks. Premature birth gives the baby less time to develop in the womb. Causes: late preterm, born between 34 and 36 weeks of pregnancy. Moderately preterm, born between 32 and 34 weeks of pregnancy. Very preterm, born at least then 32 weeks of pregnancy. Extremely preterm, born at or before 25 weeks of pregnancy. Symptoms: a premature birth means that your baby has not had the usual amount of the develop in the womb before needing to adapt to life outside the womb. Small size with a disproportionately large head. Sharper looking, less rounded features than a full-term baby's features due to a lack of fat stores. Fine hairs covering much of the body. Low body temperature, especially immediately after birth in the delivery room due to a lack of stored body fat. Labored breathing or respiratory distress. Lack of reflexes for sucking and swallowing, leading to feeding difficulties. Complications: while not all premature babies experience complications, being born too early can cause short-term and long-term health problems for preemies. Generally, the earlier a baby is born, the higher the risk of complications. Birth weight plays an important role too. Short-term complications: breathing problems, heart problems, brain problems, temperature control problems, gastrointestinal problems, blood problems, metabolism problems, immune system problems. Long-term complications: cerebral palsy, impaired cognitive skills, vision problems, hearing problems, dental problems, behavioral and psychological problems, chronic health issues. Treatments and drugs. Supportive care: being placed in an incubator, monitoring of your baby's vital signs, having a feeding tube, replenishing fluids, spending time under bilirubin lights. Medications: a liquid surfactant squirted into the lungs to help them mature. Fine mist, aerosolized or IV medication to strengthen breathing and heart rate. Antibiotics if infection is present or if there is a risk of possible infection. Medicine that helps close the heart defect known as patient ductus arteriosus. Surgery: a feeding problem by placing a central line to deliver IV nutrition. Necrotizing enterocolitis by removing the damaged part of the intestines. Patent ductus seriosus when medications fail to work by closing a blood vessel near the heart. Worsening hydrocephalus by placing a plastic tube called a shunt to drain excess fluid in the brain. Taking your baby home. Can breathe without support. Can maintain a stable body temperature. Can breast or bottle feed. Is gaining weight steadily. Is free of infection. Living arrangements. Other children in the household. Adult relatives and friends to provide help. Primary pediatric care. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you.